A national substance use research organization is warning about a new type of opioid that is increasingly being found in Canada's unregulated drug supply. The Canadian Centre on Substance Use and Addiction says there is a rising presence of potent synthetic opioids called nitazines in the country's drug supply. The rise coincides with an increase in prevalence of benzodiazepines, which are often used as sedatives and tranquilizers. Meanwhile, advocates are sounding the alarm on Canada's toxic drug supply as more and more people die due to preventable poisoning from unregulated drugs. Well, joining us now to give us more insight into what is being called a poisoning crisis is Donald MacPherson, the Executive Director of the Canadian Drug Policy Coalition. Sir, welcome to Forum Daily.
Thank you. Nice to see you.
Now, it's clear that the unregulated drug supply in Canada is becoming more diverse. So how has this expanding supply impacted preventable deaths in the country?
Well, first of all, the supply is unregulated. So it's manufactured around the world in various laboratories and transported to different regions. So there's no quality control, there's no distribution control. So it's something that's been going on for many, many years now, and we know that an unregulated drug market is becoming more toxic, and it's taking more lives than ever before.
And we have seen a rise in drug use during the pandemic, but this isn't a really new problem for Canada. How has the opioid crisis been impacting Canadians even before the pandemic?
The major change in the illegal drug market took place in the early teens, 2012, 13, 14, when highly concentrated fentanyl began to appear in the illegal and unregulated drug market. And that fentanyl just increased in the number of people who were dying from fentanyl poisoning increased, and to the point where we're setting new records every month, every year. 80 to 90% of people who've died from overdose or drug toxicity have had fentanyl in their systems. So it's an absolute unmitigated catastrophic failure of our public policy, and is something desperately needs to be changed.
It's really hard to hear those numbers. Now, why is the supply so toxic? What are the reasons behind these drug poisoning deaths in Canada within this illicit supply?
It's the nature of an unregulated illegal market. Unregulated illegal markets tend to favor the importation and creation of highly toxic substances, highly concentrated substances, which are easier to transport, easier to smuggle, and then get mixed in various regions of the country. But the fentanyl molecules are so powerful, it's almost impossible to mix them outside of a laboratory. And it's a change in business model for the transnational organized crime groups that control drugs around the world. And it's not going to end. It's not going to end until we do something fairly common sense like take these drugs away from those organized transnational criminals and create a regulated supply of drugs that people can have access to.
Just about a minute left here, Mr. MacPherson, but tell us a little bit more about this. This is called a preventable issue for a reason. So what steps need to be done to take care of this toxic drug supply in Canada?
Well, in the crisis that we're experiencing right now, we need to scale up safer places for people to use these substances so that they have ready access to drug testing, to naloxone, which reverses overdoses, and not places where you're not using alone. In the longer term, we need to move towards a much safer supply of substances. People are going to continue using substances. So we need to acknowledge the danger that exists in the market right now and move towards accessing a safer supply up until legal regulated supply. That's the main intervention that will get rid of the toxic drug market.
All right, Mr. MacPherson, thank you again for joining us today on Forum Daily.
Thank you.